Today, we are covering a condition that affects thousands of people every year, and it starts with something as simple as a blocked drain. We are talking about dacryocystitis. So if you are watching this, get ready to understand exactly what dacryocystitis is, what causes it, and finally how to treat it. Here is the thing. Your eye produces tears constantly. These tears do not just sit on your eye and evaporate. They actually drain out through a system that runs from your eye down into your nose. Think of it like a plumbing system. Water from your sink flows through pipes and eventually reaches the sewer. Your tears work the same way. They drain through tiny ducts and eventually flow into your nasal cavity through what we call the nasolacrimal duct. The lacrimal sac is basically the main collection chamber where all those tears hang out before they drain down to your nose. When this system works perfectly, you never notice it. But when something blocks that drain, well, that is when things get uncomfortable. Dacryocystitis is an infection of that tear sac I just mentioned. The medical term breaks down pretty simply. Dacryocyst means tear sac, and itis means inflammation. So we are literally talking about an inflamed, infected tear sac. This happens almost every single time because the nasolacrimal duct becomes obstructed. Remember that analogy about your sink? If the pipe gets clogged, water backs up. The same thing happens with your tears. They back up in the lacrimal sac, and when tears stagnate in there, bacteria move in and throw a party. There are two types of dacryocystitis, acute and chronic. Acute dacryocystitis comes on suddenly, like a surprise attack. You might wake up one morning and suddenly feel pain and tenderness right at the inner corner of your eye, near your nose. Your eye becomes red and swollen, sometimes so much that you can barely open it. You might get a fever, and there will definitely be discharge coming from your eye. If you press gently on that area, you might even see pus or mucus coming out. This is the body's way of saying something is seriously wrong. Acute dacryocystitis can progress quickly, especially if you have diabetes or a weak immune system. Then there is chronic dacryocystitis, which is what we see more often. With this version, symptoms come and go over time. You might notice constant tearing from that eye, some mild swelling or redness, and maybe some mucus discharge. It is not as dramatic as the acute version, but it is definitely annoying, and if you ignore it, it can turn into an acute infection. What causes the blockage in the first place? There are several reasons this can happen. You could have a facial injury or trauma that damaged the area. Some people have a deviated nasal septum from birth or from an accident, and that can block the drain. Certain medications, especially those used in cancer treatment, can actually scar the duct and cause it to close up. In babies, sometimes the nasolacrimal duct never develops properly, which is why newborns sometimes get blocked tear ducts. And sometimes there are just tumors or polyps growing in the area that block the flow. When you have acute dacryocystitis, the treatment starts immediately. Doctors typically start you on antibiotics that target the most common bacteria causing the infection, usually gram-positive bacteria like staph. You can apply warm compresses to reduce the swelling and tenderness. But here is what you should not do. Do not let anyone poke around in there with a probe while the infection is active. The weakened tissue around the sac can easily tear and create false passages, which makes everything worse. If the antibiotics do not work after a few days, or if you develop a fever or notice your vision getting worse, you need to go to the emergency room immediately. This can spread to the tissues around your eye and cause orbital cellulitis, which is a serious infection that can threaten your vision. For chronic dacryocystitis, the treatment is almost always surgical. Doctors will use a probe to open up the duct and restore drainage, or they might perform a more advanced procedure called a dacryocystostomy, where they create a new bypass for the tears to drain. The good news is that with treatment, most people recover completely. If you found this video helpful and you want to learn about more eye conditions, please subscribe to the channel and hit the notification bell.